Welcome back to the channel. A bit of a bonus video for you today, and it's all about what to expect when your guinea pig goes in for surgery. And we will of course have an update on Phoebe, my piggy, who has just had an operation to remove a bladder stone, but I thought it was a great opportunity to talk a little more about surgery in general and what to expect as an owner, because exotic medicine is finally becoming more advanced and more accessible. It's not unusual these days for guinea pigs to be given the option of surgery, and even elective surgeries such as spaying and neutering are far more commonplace these days. And she says, hold please, we must drink. Are you done? Are you going to the other one? So speaking from experience, I've had guinea pigs go through spay, neuter, and now bladder stone surgeries, which are kind of mild to moderately invasive. Now you can obviously get way more high-risk surgeries where you can expect the guinea pig to be recovering for longer or face a higher risk of complications during recovery. But whatever the surgery, the first thing to do is to always find the best vet you can. Ideally an exotics vet, and you can request the vet with the most experience of working with guinea pigs too. You want someone who is routinely operating on guinea pigs every single week. So don't be afraid to ask about their experiences, their success rate, and expect them to talk you fully through the procedure and their protocol for recovery. For example, do they hospitalise guinea pigs as standard? And do they arrange one or more checkups so they are updated of the recovery progress? Okay, so assuming you're happy with the vet, you've talked through the risks with them, and it's the day of the surgery, what happens? Well, they will usually want to admit your piggy early in the morning, and you can kind of provide some of your piggy's favourite fresh food. I had a little bag for Phoebe with some lettuce, some grass, which was the most popular thing when she woke up, and some bits of cucumber and pepper, just for the vets to kind of tempt them with when they are waking up and coming round from that anaesthetic. And the vets will advise you when they're doing the op and when to expect a call from them. And that waiting around period can be really tense, so don't be doing anything too taxing or stressful during that time. And when you get the call, you'll obviously know how the operation went and when you can pick up your piggy. If you're collecting them on the same day, you'll probably notice some signs of the anaesthetic starting to wear off. They'll be a bit sleepy and sort of out of it, so keep them warm, but don't put them directly on a heat pad that they can't move off of easily. Keep them clean, keep them dry. They might be a bit incontinent and sort of just peeing on themselves, so keep changing out fleecy pads or use vet bed underneath them. And the sleepiness should wear off after about 24 hours, but pigs who are sore after surgery or who might have a longer recovery ahead of them might continue to be quite lethargic. In Phoebe's case, she was a bit woozy until the following evening, but luckily for us, she was eating and pooping just fine. So the next thing I want to touch on is pain management, which is essential after any surgery, no matter how mild. So your vet should prescribe appropriate medications at the right doses. These usually include dog metacam, also known as Loxicom or Meloxidil. Other pain medication can include gabapentin, paracetamol, and potentially tramadol in more severe cases. And as well as pain medication, you may or may not be given an antibiotic, especially with less invasive procedures such as abdominal neuters and ovarectomies, where they go in from the flanks to fish out the ovaries. The vets might not give antibiotics as standard, but if you're not sure about anything you've been prescribed and the doses you should be giving and how many times a day, then just ask the vets. So you brought them home and you're wondering whether to keep them separate or put them straight back in with their friends. And personally, I think putting them straight back in with the herd is the best option. Just gonna pop her in the cage now. I've got her in a little snuggle sack over here. What usually happens is the others are a bit sort of, oh, where have you been? Like, I recognise you, but... So they're probably not going to pester them, and I think it can help to have their friends around them. It can encourage them to start eating and acting normally again. And you can make a cosy area of the cage for them, and most likely the others will sort of leave them to it and not bother them. So I had this end of the cage all set up with Phoebe's blanket and some hay nearby, and the others pretty much just left her alone and let her relax. Also, sometimes if they are split up for more than a day, you can get dominance and confrontations happening, which is not a fun thing to deal with, especially right after the operation. Next up is a biggie, and that's ensuring your piggy is eating enough. Pain and the after effects of anesthetic can mean that they don't want to eat, but it is absolutely essential that they do eat and that they stay hydrated. Our piggy's digestive systems basically rely on a constant movement of high fibre foods, otherwise there's a risk of something called gut stasis happening. Remember that they've been waiting around at the vets, being prepped for surgery, the surgery itself, and then waking up afterwards. There might have been a period of several hours where there's not been any eating going on. And no matter what the surgery, I highly recommend having some form of recovery food or critical care on hand and syringes, and I will put a super useful guide down in the description below from Guinea Links. This is the method that I use, using 1 ml syringes with the end cut off. It's safer and easier and less messy than trying to use a much bigger syringe. Also offer things like grass, herbs, veggies. If your piggy will take them as well as the recovery food, then that's good, and you can wet the veggies down to help them stay hydrated as well. And you can also syringe water on its own, or it might make it a bit more palatable and tasty for them if you mix it with something like Pro C, which also has vitamin C and probiotics in. It really does vary with how long it takes piggies to start eating and drinking again. For some, it's straight away the moment they wake up from surgery, but for many pigs it's within 28 to 48 hours, and some it can be even longer than that, days or even a week. So in those cases they definitely need hands-on critical care and support throughout all of that time. I do have a healthcare section down in my Amazon storefronts in the description below where you can buy all different sorts of recovery food in syringes, so go and check that out if you want to get stocked up. Next up is healing, and fortunately guinea pigs heal miraculously well, so do check their incision area a few times a day. It's normal for it to be a little bit lumpy looking because of the stitches, and as it heals it might turn a bit scabby and crusty, but what's not normal is any big swellings, for it to look inflamed and red looking, and it obviously shouldn't be coming apart or have any discharge coming out of it. Sometimes you can get a little bit of stitch poking out. This is usually fine as long as everything else looks good. And some guinea pigs can interfere with their incisions, but fortunately most don't. If, however, you are concerned about them nibbling at it or that there could be some kind of infection going on, then contact the vets immediately. It can also depend on where on the body the incision is and how high the risk of infection is. So for example, with a standard neutering procedure down at the testes, which is obviously very close to the bottom and that area around there can be quite a high risk of post-operative infections, which is why a lot of vets these days prefer to do the incision higher up on the abdomen and fish out the testes from down below. Sorry boys if you're listening. And there might also be surgery specific signs to be aware of, such as pain when peeing or blood in the pee after a bladder operation. Your vets should inform you of anything like this. And as for healing, often it can take around 7 to 10 days for an incision to be more or less fully healed. Up to 14 days is the healing time for more internal incisions, such as a hole in the bladder. And as for little Phoebe here, she is a-okay being held at the moment, by the way. We are 5 days after surgery. Look at her little shaved belly, it's so cute. And I'm really pleased to say that she is continuing to do really well, and she has even put weight on. So it's a great idea to weigh your pigs before and after the surgery as well. But we hope that you found this video useful, guys, and you know more of what to expect if your own piggies are going in for surgery. And if they are, of course, best of luck to you and them. I hope the recovery and everything goes fine. But that is all from us for today. As always, thank you for watching, and we'll see you soon. Bye bye.